Hi, I'm Dr. Lisa Goodman. I specialize in the Graston Technique, which is a cutting-edge, non-surgical technique for treating muscle and ligament injuries.
A couple years ago, I was experiencing some extreme pain through my back, out down my arm, and sometimes to a leg. And after some prodding from some friends, I finally determined I needed to go see a chiropractor, and I finally came in to seek some treatment.
I'd been going to chiropractors for a long time, and I had a nasty tennis elbow problem that I tried everything for. I went to physical therapy, I had cortisone shots, but I was getting no relief.
Using the patented stainless steel instruments of the Graston Technique, I'm able to specifically detect adhesions and scar tissue deep under the surface of the skin.
She could use the tools along my areas of pain and really just kind of rub them right out and make sure that she was getting to the source. And the wonderful thing about this was that with repeated visits, I could actually feel the pain retracting from my extremities and back to the center of the injury, so that I could really tell it was all pulling in to the appropriate place to be obliterated in the end.
The combination of passive and active treatment create a fast healing response. Many patients feel relief after just one treatment of the Graston Technique.
It seems like every time I come in, I'll tell the doctor, hey, I noticed it when I was doing reverse curls, and so she'll then work on the back part of my arm, or from doing curls, and then it's on the biceps. So if you discover an area that hurts or feels bad when you do a certain activity, then you target that one spot and you do that activity while the treatment is being done, and that really seems to make a difference.
Yeah, I don't really know what happened, but I just slowly started to, in the inner part of both of my knees, I started getting a lot of soreness, and it almost felt like a tendonitis, and I was really nervous about that. I had some issues with my knees in the past with just different injuries, so I was kind of worried that maybe I was getting some tendonitis and there was going to be some real issues with that, and mentioned that to her, and she went and checked it out and just noticed it was a tightness of all the muscles coming together from the different parts of the leg into that part of the knee. So again, she introduced Graston to that, and also some flexibility exercises. It's been amazing because I was not doing legs for a while, and now I can go back and do different exercises with my legs and run and do a lot of things that I had to stop.
The Graston Technique has been proven to be one of the most effective treatments for many common injuries, including tendonitis, IT band syndrome, shoulder impingement, Achilles tendonitis, tennis elbow, and many more sprains and strains.
Prior to the treatments, I could not pick up a glass of water with this motion here. Within 2 treatments, I could do pretty much anything that I could do before. Probably 6 treatments later, I pretty much was cured, and I was back to playing racquetball and playing guitar and using my right hand to mouse and everything else. So it has, I think now it's been a year plus now, but that little ailment of my body is totally cured, so I'm glad about that.
It was like it didn't exist anymore. It was wonderful. I could sleep at night, I could work all day, I could sit at my desk and do everything I needed to get done to live my life.
The Graston Technique can be effective on an injury you suffered last week or one that happened 20 years ago. If you have a specific injury you'd like to discuss with me, call my office and we'll set up a time to talk about it.